Good evening, everyone. I hope I'm audible. Vikrant, am I audible?
Yes, Valerie, you are audible.
Thank you. Good evening, everyone. My name is Valerie, and I would like to welcome you to another session, panel discussion of the COVID-19 Academy. As most of you must be aware, the COVID-19 Academy is a joint collaboration between UNICEF, WHO India, HCL Foundation, and Sphere India, with an aim to build capacities of frontline workers and outreach workers for COVID-19 preparedness and response. Today's panel discussion is on COVID-19, the new normal. So COVID-19 Academy, in partnership with NIDM, is hosting a panel discussion on COVID-19 as the new normal. The post-COVID-19 realities bring a paradigm shift and a new normal for disaster management. The plenary will explore how the stakeholders are adapting to it and innovating new ways of working. For this discussion today, we have with us Major General Manoj Kumar Bindal as the keynote speaker. As panelists, we have with us Professor Santosh Kumar from NIDM, Mohammad Asif from Plan India, Mr. Srirang Davale from Tata Sustainability Group, Mr. Sarbjit Singh Sahota from UNICEF India, and Ms. Annie George from Bedrock. Vikrant Mahajan will be the moderator for today. But before we go ahead and begin our panel discussion, let me just take a moment to do a short round of introduction for our keynote speaker and our panelists. Major General Manoj Kumar Bindal is presently the Executive Director, National Institute of Disaster Management. He was commissioned into the Corps of Army Air Defense in December 1985. An alumnus of National Defense Academy, Major General M.K. Bindal is a graduate of Defense Services Staff College and has attended the prestigious Higher Command course at the Army War College, besides excelling in all other career courses in the Army. He holds a master's degree in Defense and Strategic Studies, as well as Masters of Philosophy in Defense and Management Studies. During his more than 3 decades of service, he has held important command and staff assignments. Having held all these echelons of command within an air defense regiment in diverse theaters, he commanded an air defense regiment and an air defense brigade in the Kashmir region against the backdrop of counterinsurgency operations. He was the general officer commanding of a sensitive sub-area in the Northeast. He has been on the staff of a mountain brigade deployed in counterinsurgency operations and in high altitude area, an armored division deployed in the plains, a desert corps, and in a corps HQ in the high altitude areas. He has also been posted as Deputy Director General in Directorate of Army Air Defense, where he was dealing with operations, training, air defense control and reporting, and air intelligence issues. Major General M.K. Bindal served as Provost Marshal in the United Nations mission in Mozambique, where he was deeply involved in the liquidation of the mission. He has been the Director, Center of United Nations Peacekeeping, New Delhi. For 3 years, he was also the Secretary of International Association of Peacekeeping Training Centers. Welcome, Major General M.K. Bindal. Very pleased to have you with us. I would now take a moment to introduce our other panelists for today. We have with us Professor Santosh Kumar, who is a professor at NIDM. He is a disaster risk reduction policy planning and capacity development expert with 25 years of experience in different positions in the development planning and DRR sector. A PhD in economics, he studied gender and development in IDS, Sussex, UK, and received professional training in disaster risk management from Israel, backed with international work exposure at the World Bank and intergovernmental body of SARC. He has also worked at state levels in different capacities in UP Academy of Administration, Nainital, and RIPA Jaipur. He has an experienced hand in designing, planning, and implementing mitigation and long-term disaster recovery plans and projects. Welcome, Professor Santosh. I would now like to welcome Mr. Mohammad Asif. He is the Executive Director of Plan India and Sphere India Chairperson. He has more than 20 years of development and humanitarian experience. Asif joined Plan India in 2006 and took on a national role as Director, Program Implementation in 2009. Over the past decade, he has ensured the successful implementation of over 500 development projects across India in partnership with more than 100 grassroots NGOs. He has been an active member of several working groups within Plan International and is the global chair of Plan's National Office Program Directors Network. Prior to Plan India, Asif served with ActionAid International India and the Indian Social Institute. He is an alumnus of the Department of Sociology, Delhi School of Economics, University of Delhi. Next, I would like to welcome Srirang. Mr. Srirang Davale's roles and responsibilities in Tata Sustainability Group include disaster response and social development program management, planning, deployment, and impact assessment. Prior to joining TSG, Srirang has worked with Tata Motors to strengthen CSR, sustainability agenda, and affirmative action. He also has experience working on human rights to bring in community perspective in corporate processes, as well as CSR strategy development. He's worked for over 11 years with ActionAid International and on disaster response. Welcome, Mr. Srirang. Next, I'd like to welcome Mr. Sarjeet Singh Sahuta. Sarjeet Singh Sahuta is an architect and urban planner with over 25 years of professional experience working in frontline humanitarian and development agencies. He currently works with UNICEF as a disaster risk reduction specialist. He's experienced in steering development and humanitarian strategy, leading organizations, programs, and projects with frontline agencies in the domain of community social development, humanitarian program management, capacity development, disaster risk reduction planning, urban planning, and design. Our next panelist is Ms. Annie George. She is a development and management professional with over 30 years of experience in planning, designing, implementing, and supporting development interventions. Experienced in all aspects of rural management and specialized in livelihoods and monitoring and evaluation. She's currently focusing on disaster management with over 15 years of experience in different disasters, including 2004 South Asian tsunami, Kosi and Nargis floods, and cyclones Iwan, Phailan, Gaja, cloudburst in Uttarakhand, floods in Kashmir, earthquake in Nepal, and floods in Kerala. Welcome, Annie. And last but not the least, I would like to introduce our moderator for today, Mr. Vikrant Mahajan. Vikrant has 24 years of professional experience working at interagency policy level and frontline humanitarian action with government, UN, corporations, CSOs, and armed forces in diverse contexts. He represents on governance and policy level committees of several international organizations and currently works as the CEO of Sphere India. Welcome, Vikrant, and over to you, Vikrant. Thank you.
Thanks, Valerie. A very good evening to all of you. So we are in a world post-COVID, a new reality, a new normal. I think as we're following the trend and as we hear the global leaders, including our own honorable Prime Minister yesterday, it seems that now the virus is there for a long time, and it's going to be there around. And what we need to do is to find a way of life which adapts to it, and that's the new normal. As the various stakeholder groups, various business houses, the life as such from a household to the communities adapts to the new realities with social distancing, with the more focusing on the hygiene and other practices. We also need to see that how our professional world of disaster management, to where we all are together here, need to adapt and innovate in find new ways of working in this context. So I think we'll build further on this thing, but first of all, I think I'll request Major General Bindal. I think he will, through his keynote address, he's going to take us and to build the need of this new normal, why we're discussing about it, why this new normal, the new way of working is required today. And also he's going to put up his perspective as a leader of the National Disaster Management. Over to you, sir.
Thank you, Vikrant. First of all, thanks so much for Sphere for organizing this particular workshop, which is so pertinent in today's world. We are all aware that this particular pandemic has pushed us to our extremes, wherein we are at there's a spiral of confusion, economic loss, economic crash, social stigmas, loss of lives, and it is hard to comprehend as to where we are going from here. The exponential surge of the cases is also adding to the woes as to we don't know as to for how much do we plan for how long do we plan for. We are not even aware when will it end. If it ends, when will it research? Will this pandemic be the only kind, or it might come again, maybe after a few years, after a few months, or maybe decades or so? Or is it a 100-year event? So there are so many contingencies, uncertain future that we are not aware of. And are we prepared for such a future? Are we prepared to handle such emergency situations? And finally, the main question, which is pertinent to today's topic, is will things go back to normal once this pandemic ends? That is the topic for today, which has been very well selected. And I congratulate Vikrant for doing the needful. We are aware that for next 12 to 18 months, we should be grappling with this particular pandemic in the search for vaccine, in the search for finding ways and means to work through it, in the search for uh, ensuring healthcare systems are put in place, and we are able to take care of this. Progressively, we increase our capacity to take care of this particular pandemic. And the socio-economic impact will have a long gestation period to research. That is a issue which also is a topic for today as one of the subtopics. But we are also aware that human beings are very resilient. We always bounce back. And with that hope, we will be looking for new innovative reforms, new hope of recovery. And eventually, we will make sure that the things come back to the normal. Now, here the question is this normal that will come back to, will it be the same normal? Or this will be a normal with a new set of standards and rules, which today in this particular webinar, it is being called the new normal. As we are bracing for the end of the lockdown, we are all faced with disruption in our daily life. There's a tectonic shift in the way we are doing business, the way we are going about doing our daily routine, and that has to become the norm of life. Today, the social distancing with protective measures is has been found as one of the key instruments to fighting this pandemic like situations. But it also poses a very major challenge. Disaster response, too much of social distancing or too less of social distancing, both has its pros and cons. What to do? How to evacuate millions of people during uh, say like funny like situation? How to go about social distancing at that level? How to take care of health of everyone in view when already this pandemic is on? So there will be a whole set of new realities that are coming in, whole set of SOPs, procedures, equipment, everything will need to change. Both resources, both men and material required will be much more. So this is what we are referring to need for a new normal. Inclusive approach. Now, social stigma has become another class. Earlier, we used to have uh, we should look after the women, we should look after the weak, we should look after the marginalized, we should look after the people with disabilities, and so on, so on. Now, social stigma connected to a COVID-19 patient is also bringing out a separate class of people who needs to be included in all our programs. Financial crisis. It is a major issue. Socio-economic impact of the pandemic. Restarting business as usual will not start. It is not like a flood has come and gone and we start a business the way it was before. Now, with this social distancing issues, it will limit the production. It will limit our efficiency. So, will it raise the price of commodities? What about the job loss? What about the redundancies that are now required to be built more and more into your production supply chain management? This 54 days of lockdown has given a lot to think about. It has also made us realize that there is a large number of materialistic things which are not required. So now it's a question by itself that when we come back once the lockdown is lifted, will everyone go back to the previous normal of a buying spree? Or will there be a lifestyle change, which will again bring down the market? So there are so many issues which need to be discussed as to what this new normal will be. Self-reliance, already Honorable Prime Minister said about yesterday, that will change the World Economic Forum altogether. The import export that was the norm of the day, globalization was the norm of the day. Are we going to shrink and think only in words or maximum in words? Multi-hazard scenario. Now, this is a live thing which is coming up. We have a low depression building up in Bay of Bengal, which is moving towards our eastern coasts. If it makes a landfall, then what happens? In such case, if there's a landslide, there's a flood, how do we deal with it? So the new normal also is talking about technology-driven initiatives. Because of social distancing measures, is there a need to develop technology so that we can ensure social distancing as well as ensure that our business goes on as usual? So it's a more of a wake-up call that we need to think our priorities, both economic activities, human health, to ensure the sustainable development of the planet. However, we are making short-term strategies, mid-term strategies, long-term strategies. But this new normal, for each of them will continue to shift. What is applicable for short-term strategy may change after a certain period of time. So this new normal by itself will also be a very dynamic and will keep changing with time as we progress further. So having said this, I will finish my talk because I was given 5 minutes. That is a very apt and relevant topic for discussion today. And the list of panelists are very eminent people who are experts in their own field. I am looking forward to listening to them and learning a lot from them. Thank you, Vikrant.
Thank you so much, sir. It was really to put the perspective why we need to have, why we're looking at it as a new normal and the change environment in which we need to find new ways of working. Um, so we will have a very eminent panel today, and we'll go through a series of questions to this panel and build a discussion over that. My first question is to Professor Santosh. Sir comes from being an economist and all. Sir, while the impact on economy on most of the sectors is very huge, in particular, it has brought the informal sector, the migrant worker, daily wagers, the urban poors in spotlight. And we are seeing the stories not only in media. I think today there's no road, no highway in India where we're not seeing the migrant workers as they're moving back as returnees. So, sir, how do you think the economic policy is going to adapt to this new reality? Uh, uh, Prime Minister has made yesterday a very inspiring and motivational speech, and also released a good economic package. But I think going on nitty-gritties of this, how is it? What the shift in the economic policy we're going to see to come to this new reality of the India's informal sector? Over to you, sir. Professor Santosh. So you have
Professor
to unmute
Santosh,
yourself, maybe.
yeah, I've unmuted you, so could you just say hello? Professor Santosh, can you hear us? Are we audible to you?
Seems like maybe some problem with the mic, Valerie. Well, you can connect with him offline, and I think I'll move to the next question. We'll come back to Professor Santosh later. My next question is to Mr. Sarabjit Singh. So you come from the UN, and how the UN system in India adapting to this new normal? What new systems, what a different humanitarian architecture and new ways of working we need? Over to you.
Thank you, Vikrant, and namaskar to General Saab, and to all the online learners. I'm really, I'm a trainer by passion, and this is the sort of new thing which I'm learning, that how do you train people online? And I think this is part of the new normal. And NIDM has been on the forefront of training. So I think this is so apt that we have today ED and IDM to initiate us into this workshop. Now, when it comes to UN, by very nature of our mandate, UN is in support of government anyway. So the future we want, the UN system we need, I think is hugely contingent on coming together of government, UN, civil society, private sector, and others to define the current context. As General Saab has mentioned us, that the new normal is going to be shifting. And it's not something one thing. It might be many things, and certain things might be evolving, so some other things might be recovering at the same time. So this is going to be hugely complex. And when you have such complexity and scale of problem, the first thought within UN system particularly goes to partnerships. The significance of work culture of partnership can hardly be overstated. So predictability in this partnership and the flow of resources can be the new normal. That our partnerships, our commitment to working together will be the new normal. Can that happen? Why and what do I mean by predictability? For example, I'll just use number of examples from Kerala, where you were also involved and many of us were involved. And I'm going to use some of the examples from Kerala. For example, the government-led accountabilities to affected population program, AAP, we achieved in Kerala. But that shouldn't be an exception. Rather, it should be a normal response to all emergencies in all states. So in future, I expect that AAP programming, government-led AAP programming, should become a new normal. So today I will try to speak more about what can we do, and what can our state governments particularly do. Look at the openness of government of Kerala to partnerships with civil society, UN. Shouldn't it become a new normal for all states? I think it should. When we look at the picture from the other side, from the side of the civil society, the whole of the society participation in response in Kerala should be the new normal in all states. In Kerala, we saw everyone coming together, all institutions, all civil society, private sector, including NRIs, everyone participating. That kind of whole of society approach should become a new normal in all states. This is easier said than done. This requires systemic and attitudinal shifts at society, government, civil society, private sector. Everyone needs to undergo some kind of a change, and most importantly, I think for partnership, we need to take pride in each other's work. We currently see each other sitting on the other side of the fence, and I think new normal can be about taking pride in each other's work. And the second part of my, when I say system shifts, may I request all of you, those of who are participating, who are participants, to type in the chat box, move from schemes to systems. So for a long time in India, we have been doing a lot of work piecemeal and in different schemes, but we have never strengthened the systems. We got to rebuild the systems. Rebuilding systems, strengthening systems can be a new normal. It is right that And this is not a new idea which I'm giving you. This is a very old idea. Only thing is that many of these ideas were stuck due to many reasons. We will not go into the reasons, but probably this is the right time to push those decisions that have been pending for a long, long time. So that's the new normal. Hmm? So nothing is more important, more powerful than an idea whose time has come. Huh? This is Victor Hugo, many centuries ago. Hmm? So I think this is the time. The new normal is about pushing all those things which have been pending. Uh, so we are very much aware of the practice areas. For example, just coming back to our own home, that's the humanitarian work. That for many years we've been sort of uh, we know that humanitarian architecture is missing in India, hmm, for to do some predictable work. And what are the functional areas within humanitarian system are also well known to us. Now, how do we help these to emerge as a strong humanitarian system backed by predictability in various practice areas such as coordination, information management, etc., etc.? I think that should be the new normal. So we should now expect that we have uh, more sort of emphasis on systemic approach to handling things. So Vikrant, I'll stop here. Maybe
Right.
I should listen more, and probably listening more should be the new normal as well.
Yeah, thanks, Sarabjit. I think you said a lot, but you said a lot of important things there. Uh, I think it's about systems, from schemes to system. Is I would take it as a new phrase. I think the new mantra we should look at. Uh, I think in between, I'll just quickly check with Professor Santosh and Sir. Am I audible? And can you test your mic now?
So Santosh, could you say a hello, please?
Uh,
Okay, no problem. Vikrant, I'll try it again through some other system.
Yeah, just see if he has got some headphone and he can try through that. Probably that helps sometime. In the meantime, I go to our next panelist, Mr. Mohammed Asif. Asif, your leading Plan India is one of the big NGO in India and a very important part of the system that Sarabjit was talking about. So, how is Plan adapting to these new realities? We understand that a lot of programming Plan has already been doing for the development and the humanitarian when the COVID strike. But how are we adapting these new programs, and how the programs are still delivering what's supposed to do, and what is changing in them? Over to you, Asif.
Thank you, Vikrant. I hope I'm audible to everybody, and good afternoon, everybody. No, and first of all, no, thank you to Major General Bindal Saab for giving us a very good no, overview of how no, he thinks and how NIDM no, is thinking about the emergence of the new normal, and what is going to how things are going to look like. And just to very quickly summarize, I think no, the new normal, what as no, sir mentioned, is around looking at how norms, attitudes, behaviors are going to change, how our social and economic resources are going to change, how our policies, budgets, and no, services, how they are going to change, and therefore it is very of critical significance that no, we start understanding where exactly are the changes going to happen, what and in what measure would they deepen certain things, or would certain things become irrelevant, redundant, no, something else becomes much more critical and focused, and which requires attention. So I think it's still we are still in the process of trying to understand how the new normal would look like, and same with us here at Plan India. But definitely, what we do know is that, especially in the humanitarian space, no, the how part of it, on certain things about how, and we have been over the decades we have been understanding, and Sphere has been leading the whole process of trying to establish the standards insofar as humanitarian relief and aid gets no delivered to people, to affected communities no, on the ground. And I think all of us have been seeing it very much on the media, no, in our television sets, as well as no, many of us who have been engaged in the distribution process itself, the humanitarian process itself. We have seen that the new normal is looking at no, ensuring that relief is distributed while ensuring maintaining no, social distancing. So no, the earlier model that you just no, had people out there are new ways in which people are making efforts, and I'll give some of the efforts that we are in at Plan has been have been doing, and I think probably that's how it looks like things are going to move, especially insofar as no, making no, basic no, humanitarian relief to people who need it the most. Uh, See, I think we are talking about ensuring distance between two people when we are talking about doorstep delivery of relief material where it is possible. We have been practicing about contactless humanitarian relief distribution, and these are social innovations that have been that have come up no, through people the whole no, use of masks, the way and even the type of relief material that's been distributed in the communities. There's been a lot of thinking around that which has gone in, and not just planned. Many of other organizations, including the government, has been taking great efforts in trying to revisit and no, understand how no, people who are in challenge and distress, how their no, crisis is being addressed. At another level, I think one of the key things, and that's an important part which I wanted to kind of highlight here, and many things Sarabjit has already talked about. But one thing I want to kind of re-emphasize and talk is the whole no, the whole idea of more intense, more dense collaborative working, particularly between governments and civil society. And we've seen it in districts after districts. The way the district officials, the way they have come forward, they've worked hand in hand with NGO workers, grassroots frontline workers, frontline health no, personnel like ANMs, ASHAs, how they have no, joined this whole thing. So that whole connect that has established is, I think, also an important no, development, which I think not just needs to be celebrated for now, but also is something which will emerge as the new normal, because there is an intersection that's going to happen between public health and humanitarian or disaster response programming, because public health issues are going to stay, as no, Major Saab earlier mentioned, Major General Bindal Saab earlier mentioned that we this is no, the virus is there to stay, so it will be no, sometime before we see the end of it. Until that time, probably we have, especially now that we are in entering a season where we may have floods and cyclone season, so probably there will have to be a greater intersection between public health and humanitarian work, and how that then evolves as a way of no, working on the ground to address humanitarian concerns. So I think with these words, I'll kind of end by saying that there are going to be a lot of significant shifts. They are not because we desired so, but it's because it's now the need of the hour. And many of these, as Sarabjit highlighted, are not new. They have been discussions that have been happening even pre-COVID, and but what COVID is doing is kind of accelerating the process of getting many of the old ideas getting packaged into no, something which emerges as the new normal, in which we are able to work with communities both on the development, on the humanitarian, and in the nexus between development and humanitarian processes. Thank you, Vikrant.
Yeah, thank you so much, Asif. I think that's it. I think the COVID has made it really the different stakeholders now to come together to look at more collaborative partnerships I think we see the way some of the government and warming up to the partnership with the CSOs and other stakeholders has perhaps not been there for many years before. Uh, One very important cog in this wheel of system which Sergio are talking about is the CSR. And we have with us today Mr. Srirang, who represent Tata Sustainability Group here. So my next question to you, Srirang, with the economy taking a big hit, how do you think it's going to impact the CSR fund flows in India in next few years? And uh, what do you think the CSR will be opting for more direct partnership with the government or vis-a-vis the balancing to partnership with CSOs? But again, mechanism like the Tata Sustainability Group also do a lot of direct programming. So what do you think is going to be the norm ahead? Over to you, Srirang.
Thanks, Vikrant. Hello to everyone. Am I audible, Vikrant?
Yes, very clear, Srirang.
So first of all, thank you so much. Nowadays I'm unable to meet 4 or 5 people. I've seen your attendance list, and there are about 280 plus people on this webinar. So I would wait for that interaction to happen. So I'll be brief in my response. Uh, One is, you asked me about CSR funding. CSR funding in India traditionally is linked because of the CSR Act. It's linked with your profits, and we don't know how badly we are going to be affected because of this COVID crisis. So there is a lot of discussion that you all are having about new normal. My question is, do we know what's the new abnormal yet? So have we bottomed up yet is the question. So when we talk about new normal, we must also understand and accept that we don't know whether we have still understood the new abnormal that we are seeing. On CSR funds in particular, yes, we are going to be taking that hit. How badly the CSR funding, which has reached about 18,000 crores, how badly it's going to go down, it's not yet known. But there are other good news, and one is that this pandemic has actually decisively given that message. At least till today, we can see that everyone has accepted that we are in the same boat. So everyone needs to do something about this. The businesses, for example, just to give you an example from the Tata Group, businesses have repurposed what products and services they are making. So a plant of Rallies, which is part of Tata Chemicals, has been repurposed to produce a pesticide plant is producing sanitizers and disinfectants today. Our Taj hotels and Ginger hotels have been repurposed to give shelters to the health functionaries. So the good news here is, if we don't just focus on CSR funds alone, where there is a bad news there, the industry has a lot of other things to offer to the humanitarian space. And there I have seen that not just Tata's, but many other companies have come forward. You would have seen Mahindra's and also Tata's are trying to manufacture ventilators at much lesser cost than what it is available today. So this would not have happened had this possibly, perhaps we would not have found ourselves in this situation. So there is a bad news on funds front, but there are other positive signals as well.
Well, thanks, Srirang, for showing the positive around, and also is, I think, the news in terms of the funds flow for CSR and others, how the economic package also the Prime Minister has announced this. I think as the resources would open up from other sources. So I think we move to our next panelist, Miss Annie George. She comes from a very grassroots level action, and I know her for her passionate work, especially on the livelihoods with the agrarian and fishermen communities. So, Annie, how do you see this the new normal, and also what Shiran called about the abnormal, impacting your work, what can be done differently about it? Over to you, Annie.
Vikrant, if I may just come in for a second, this is Valerie. Professor Santosh, I can see your video. Can you just say hello? Right, I can. Yeah, yeah, we can't still hear you. Okay, fine. Thanks, Vikrant. Over to Annie.
Over to you, Annie. Annie, you have to unmute yourself.
Hello,
Yes, we can hear you
am
now.
I audible? Yeah, okay. I'm sorry the bandwidth over here is rather poor, but whatever be the case, I'm so happy to be here. Thank you, Vikrant, and hello to everybody. A very important question that has just been raised about how it's impacting the work at the grassroots level. Like everybody knows, the NGOs are in the field to ensure that the last mile connectivity is looked at. Now, let me just give you two examples of what has happened, and then I'll come to my concern of what is happening at the field level. In Nagapattinam, we were asked to supply, we took on supply of relief material to the COVID-affected families. Unfortunately, what happened is, because we were not supposed to be holding meetings and all that, we had to rely on others to provide us with a list of people who are really in need of such relief material. And this obviously created problems within the village about so this thing of transparency was, we were not able to meet with that because we could not actually talk to the people and validate these messages that we were receiving. The other example is from Kerala, where there were lists developed on who requires what. And these lists were developed by the local people themselves. It was a team of the local worker, the SHG CDS member over there. So then what happens is that since everybody is there, there was transparency in it, and the list that came out was a very genuine list that came out. So these two experiences made me think about what are we losing in this bargain of not being able to meet with a lot of people, not being able to validate it. So when we talk about a community-led, community-centric, transparent program, there seems to be a dependence developing in some areas, like in Tamil Nadu, on third-party knowledge about the place. And this may affect this entire program of this leave no one behind, reach the unreached, thing like that. So interestingly, what Sarabjit was talking brings to mind about how there are newer players who are emerging in this field. So till now, we were using CDS, CDOs, CSOs, NGOs, etc. as synonyms in the same breath. But over here, the Kerala situation shows that CBOs have emerged as very strong players, and they definitely will enhance the service delivery that is being looked at. So if you look at either the Kudumbasri group, that's a civil society the community-based organization. You look at the task forces that have been set up over there, those are community-based organizations. So in situations like Kerala, you find that there are other players, very well-established players who are coming in. And if you're talking about NGOs specifically, then we need to be looking at what are the changing roles, the new normals that we have to be looking at as far as NGOs are concerned. So then we move on to, okay, building up of systems or just larger scale training, things like that. So both in humanitarian work as well as in development work, giving spaces, recognizing new people coming in, giving spaces to the new people, coordinating with them to find ways of being more relevant and bringing in a synergic partnership is of very great importance right now. One of the concerns that I have as far as NGO work is concerned is that, you see, the project period is a limited period of operation. And within that limited period, you need to meet many people, you need to have many training programs, you need to do many skill building programs. With this new norm of physical distancing, safe public programs, etc., we will have to either increase the number of field staff or increase the time frame of the project. These are all aspects that we will have to again start renegotiating with people, with the new partnerships that UNICEF is talking about or CARE is talking about, etc. We will have to probably start renegotiating with these newer field level conditions in mind. So while it is extremely interesting to see the different skill sets, the different groups that are coming up, it also brings about certain concerns regarding effectivity, financial support of this thing. So we, like Sriran said, let us wait, let us watch a little bit on what is evolving, where are the gaps that have which are emerging, which are the spaces that need to be filled in. But I'm extremely sure that this kind of a network and partnership that is emerging is going to be far stronger than what we had till date. Over to you, Vikrant.
Vikrant, you'll have to unmute.
Vikrant is muted.
Yeah, you have to unmute yourself.
Yeah.
Thanks.
Thanks, Sunny. You really brought some very, very practical, hands-on action things at the community level, as a grassroots level, as to how our work need to adapt, and the new reality with the projects and the ways of working around that. I think moving forward, I think Valerie, do you want to check with Professor Santosh here?
Yes, sir, I can see you're logged in through 2 devices now. Can you say hello? Okay, I can see Professor Santosh on 2 laptops on the video right now, but I can't hear him.
My God, that's
okay. Let me try and get him to the mobile phone. Vikrant, please continue. Let me just see what I can do.
Sure. So I think I go to another real hands-on practical thing, maybe in a disaster setting. We have seen some very good examples of how we have saved lives during cyclones in Odisha, both the cyclone Pauline and cyclone Fani. More than 1 million people evacuated. And now in this kind of a situation, if we have to look at similar evacuations in the COVID context, what will be, how prepared we are, how different it would be. And I can even think about maybe the drought situation. Now when we're talking about hand wash, and the hand wash hygiene is a new normal, but most of our cities run out of water during the hot months, and the rural hinterland is, people have to go miles, especially the women and girls, to get water. So how do we see this hand hygiene, the wash hygiene in this new reality in this kind of situation? So my question is to you, Sarabjit. Will you help us through this? Over to you, Sarabjit.
Hi, Vikrant. I'm audible?
Yes, Sarabjit.
Okay, thank you. This is the real problem. And hand washing with soap is the most important element in whatever protection we want against the COVID virus. Now, hand washing also requires, hand washing without soap will be of not much consequence. So 2 elements come naturally in the picture: water, soap. Number of technologies have been around to reduce the amount of water in hand washing. Some technologies are enough to reduce the amount of water to 95%, by 95%. So just within 5% of water, which compared to a normal faucet. There are faucets in which we use droplets interspersed with air. And this is not a rocket science. Again, old idea. These technologies have been around. There are appropriate technologies such as tippy taps, paddle operated tippy taps, and so on and so forth. These been around for a decade or so. A lot of work has happened on faucets, particularly present use faucets. Tons of work has happened. Only problem is that technology selection becomes rather sort of blinkered, and people are not there and not considered. So the ingenuity with which the tippy taps and others emerged on the scene, particularly in the humanitarian sector, we have not been able to socialize these as much as with people. So much needs to be done to socialize these good ideas with people who live in water scarce regions of the country, in cities. So the tightest layer of protection comes not from water and soap, but from the knowledge, the attitude to wash hands, and the skill to wash hands. If these three things are not there, knowledge, attitude, and skill, the access to water and soap is not going to make a big difference. So people-centered approach to solving problems is the core of the sort of solution. And if we go by people-centered approach, if we apply some of these ingenious technologies which are around, which have been around for a long time, more aggressively during this period, they are not expensive, they are very cheap, some are free. Just having a hole in a 2-liter plastic PET bottle, just loosening the cap for a few seconds will send down a trickle, which is enough to wash hands. So I don't see that there'll be a huge problem in terms of access to water if people use the right technology. Second part of the solution comes from using other types of water in less ideal situations, not in the ideal situation, but in the less ideal situations. Water from say kitchen, which has been used for washing the utensils, can be quickly sort of very simple filtering, and it becomes useful for washing hands with soap. So many ideas are around. Again, they need to be socialized intensively with the at-risk population. And I don't offer any sort of long-term sustainability solutions on water. That's for some other meeting. Over to you.
Thanks, Sarabjit. I think putting this to challenging question, the perspective, may I also request General Bindal, if you can also help us guide through these questions. Over to you, sir.
Thank you, Vikrant. Firstly, if I talk about water, what Sarabjit is saying a very pertinent point as to we need to think of efficiency in water management. But I'll bring another point in focus is the change that is required in a psyche, that we need to carry out hand wash hygiene time and again, which is not so in the present day routine. So there will be a need for a lot of CSOs, CSR funds and government initiatives to set up washing points wherever feasible. So that habit, that behavioral change to wash your hands regularly has to be instilled. It has to become part of our culture now. We do that when we enter the home. We do that before we eat the food. We do it after we eat the food. So we are doing it, but now it has to be done at a very large scale, and it has to be especially done by those people who don't have that facility of a wash basin uh, everywhere. So the issues which Sarabjit said about saving water is very pertinent. In addition, the behavioral change that is required has to be brought, and that has to be done at a grassroots level, what Mrs. Annie George was talking about. Uh, so these two things combined can bring in a culture of hand wash, which will surely reduce the impact of such contagions or any other disease quite a lot. The second issue which you brought about was about cyclone-like evacuation. Now, based on our experience of previous cyclones, a national cyclone risk mitigation project was devised with the World Bank, and NDMA is executing it. It is being executed in 6 states, wherein after careful calculation of the cyclone affected districts, a figure was arrived at as to how many require evacuation, and cyclone risk uh, management shelters were prepared. Now, in that, the social distancing was not talked about. That was not a factor. In that, the amount of space given to each individual was the minimum required. Whereas now we are talking about minimum 6 feet distance wherever they are. So there will be a massive shift in the protocols of evacuation, protocols of the disaster response, and lot of effort has to be put in at all levels to ensure geographical dispersion, for ensure uh, more shelters, such type shelters coming up, more such type of camps being set up, and the area required, the resources required for the shelter and the camp will also increase manifold. So this is a paradigm shift in the way we handle disaster response today, and what we will now respond in the backdrop of a pandemic. Thank you.
Thank you so much, sir. Yeah, I think you put it together that we need more infrastructure. We will be needing more resources to manage these situations, and we are in this season entering where there's going to be more drought-like situations and also probably cyclones also. And then we also have a long monsoon season ahead where we do see most of our cities and some states primarily get flooded. So we need to look at our preparation in this new paradigm. So you also talked about the new standards. Perhaps we have to revisit the standards for space and others. So I think I'll like to go back to Mr. Mohammed Asif. Asif, in your experience, I think Plan has a rich experience of using the financial technologies for cash transfer for direct benefit to beneficiaries. And also some of the standards related to norms of dignity and this minimum standards for space and other in this context. So can you help us that how you see the use of these technologies as well as revisiting some of these standards? Over to you, Asif.
Thanks, thanks, Vikrant, for putting this very important question, because I think all of us, especially in the in the context of the COVID-19 crisis, we are looking at technology as an important kind of enabler. But I think all of us also know, and again, this is not that we have been talking about technology only in the context of COVID. This conversation on technology has been there for some time, at least the last 1 decade. Now, technology can be an enabler, and it can also be a, no, a challenge, because until if it is not used well, because all of us are well aware, no, that no, especially let's take the example of no undertaking needs no assessment, which is a very important no first step towards no, developing our humanitarian response. And if in the needs assessment process we have not been able to to listen to the voices of, say, no, what and expectations and aspirations of girls, women, of other marginalized families, people living in remote areas, what they exactly are looking for, what they are kind of no, expecting as part of the humanitarian no, need or response, be it from the government, be it from civil society or development players. No, and of course, technology as an enabler would help. But then many a times, what happens is that if it's not used well, you are not able to listen to the people who needed to be listened to. The voices of the girls, voices of women might get lost. So therefore, it's more than it's super critical now at this stage that while technology is used, and it will be used because that's the nature of how things are evolving, no, to expedite, to be more agile. But in doing so, no, utmost care and training is mounted to be able to use technology well, so that the expected outcomes, be it from a needs assessment no, process, or no, or even identifying no, potential vulnerable families who need to be no, part of or may no, be included in a cash for work program or a unconditional cash transfer program. So in all these, technology can be a game changer. It can be a great enabler, but it has to be used very very intelligently and smartly, not no, so that it does not become no impediment rather than no enabler. Insofar as no, you refer to a very important point about fintech and how no technology, especially in the finance, and fortunately, in the last 4 or 5 years, no, there are a lot of effort that has been no, done by the government towards improving financial literacy, the Jan Dhan no, account no, opening processes, the conditional or the direct bank transfer processes. There is much more familiarity that's been there with no, large number of people, particularly no, people in rural, in remote areas, in the no, the base of the no, socio-economic pyramid, on in terms of how no, they can negotiate and use and leverage no, such technologies and such no, initiatives, entitlements, especially no, when it comes to no, cash transfers. And it can, especially in today's no, time when we are talking about no, the COVID response and COVID no, which can also connect to other no, emergencies that may be on the horizon, given no, given the trends from previous years, be it cyclone, be it floods, be it any other. So technology, especially in financial cash transfers, unconditional cash transfers particularly, but also conditional cash transfers, can be a very important area for us to look at. The government has already made it intentions, and many of the cash transfer schemes, the direct bank transfer processes are already underway. And I think within the civil society, there needs to be much more no, awareness and training and capability and capacity enhancement to see how it can be taken up in a big way for the benefit of people who need no, humanitarian support the most. No, coming to a very important point which you alluded to, no, Vikrant, and I wanted to spend some time, a little bit of time briefly on that, is about no, the special and the particular needs of girls and women, and I think that's a very important, no, critical. Again, this is not a new conversation that we are having. We have been talking about gender in development and in disaster response work for quite some time now. In fact, we're now talking about gender transformative no, humanitarian and disaster response programming. So it's already there no, it has been talked of. I think the time has come to really take this much more seriously, especially in the light of no, our honorable Prime Minister, when he no gave no yesterday to the in his address to the nation, he talked about self-reliance, self-reliant India. I think self-reliant India definitely involves no active and full participation of girls and women in everything that we are talking about. And I think no our ability to listen to the expectations, to the aspirations of girls, of women, it becomes a very important agenda for no, especially as part of building the new normal post COVID. And fortunately we have great traction that has come from some no major government initiatives. No, I would especially like to mention Beti Bachao, Beti Padhao, which has really done a huge amount of work in the past 5 years. And those are initiatives on which we can really build on our abilities to how to engage no, girls and women, not just in the humanitarian planning and no, response processes, but also in terms of being very much part of in the decision making, insofar as what exactly needs to be done, how, where, with whom, how should the participation. And many of these questions are critical questions when we do our needs assessments, our analysis, our planning. And no, I would no, really say that this is the time when we need to really put much more focus and attention within civil society, and sphere can really take up an important role, being a custodian of the sphere standards, and its no, mandate to push no, the standards. And the standards definitely have a strong gender and inclusion component in that. So taking that forward, I think, is the need of the hour, and that's what the post no, COVID new normal should look like. Definitely. Thank you. Yeah, Vikrant, over to you.
Thank you so much, Asif, for putting into perspective the importance of fintech and the financial technologies, and how they are enabler, what are their limitations, and also the programming around the girls and women, and they need how they are important to be part of self-reliant India. I think I move from here to the CSOs work very close to last mile connectivity, close to communities where they have the physical connect, the physical proximity for various program deliveries as well as trainings and other components. Now, I think, well, as you were talking about girls and women, I see one of the participants also bringing up the into the spotlight about the rising, the violence against women, the gender-based violence, and during the lockdown period. So, how do you see that? These in the changing context, the space and the new roles for CSOs, while still be able to stay relevant on some of the issues where the close proximity with the beneficiaries and the communities is desired. Over to you, Annie.
Yes, Vikrant, thank you. Uh, Apart from just this thing of the changing rules and this, before that, I would like to list out the various areas where we were trying to intervening to make changes. Livelihood sector obviously is one of that, fishing, agrarian communities, etc. And then if you look at the marketing, there's been a disruption in the supply chain. There's been a disruption in the value chain. Yesterday, you heard PM talking about local to local, making yourself self-reliant. So in this context, I feel that decentralization in not just in the political scheme of things, but also in these kind of things, markets, producers, etc., make a lot of difference. The reason why I'm saying this is that I see enhanced role for women in such things. So, you know, the people we've been missing out. Earlier, we were talking about bringing all of them together, aggregating it and sending it across, things like that. But today we are talking about building up local markets. We are talking about building up house-to-house delivery systems. So under such situations, given the fact that, you see, the NGOs are not long-term players. The long-term players are actually the community. It is the community, it is the service providers, the government service providers, etc., who are the long-term players over there. So just like how in the humanitarian sector, we say the first responders, even in this case, I think a sustainable way of looking forward will be, how do we build up these first responders, so to say the first responders? How do we build up decentralized systems that will take care of all these things, be it health, be it education, be it marketing? Yes, we did come up with producer companies and all that earlier, but then it had its own problems. Today, how do we look at strengthening these kind of community-based structures? How do we look at building up those community-based structures? How do we look at putting in protocols, SOPs, etc., to ensure that the market continuity of business happens irrespective of whether people meet or people don't meet? That is where I see NGOs playing a major role now. How do we build up systems? How do we strengthen the community-based organizations? How do we put in place, say, a cold chain, say aggregation? You have local to local sales, you have local to inter-district sales, you have local to global sales. Now, in these cases, local to local sales, how do you build it up? Ensuring that people do not crowd together in the market spaces. How do you help a woman vendor, a fish vendor, to build up her own clientele, so that if you give her mobility, if you give her communication tools, then she builds up a small clientele group of her own. She calls and says, this is the fish that I have. Do you want it? Do you not want it? She goes only to that place. So there's no crowding in the marketplace. So these are kind of things that we need to be thinking, not only thinking of, but building up, so that irrespective of whether we are there or not, these community-based systems will continue. And along with this, NGOs also need to play a strong role in building up the skills of the people who are going to be using these systems, be it startup people who are providing mobile apps for it, be it the LSGIs who are looking at how to put all this in place, be it Kudumbasri who is looking at how to handle health systems and this. In all these issues, capacity building of a different set of players to look at a different set of tools is what is required right now. And in all this, I find that there are adequate and more spaces for the women who have been continuously getting sidelined because of more and more of mechanization, more and more of globalization. So this I see as a wonderful opportunity where we can utilize women at the local levels and build up their livelihoods in this changing scenario. Yes, now to go to the question that you had raised about the increase cases against women. Killer did a study over here. Killer is the Kerala Institute for Legislative Medicine. And they did a study, and they did find that there were many more calls that were coming in, but those calls were not related to physical abuse, but more in terms of harassment, mental harassment, and things like that. Kerala, I have not seen anything in the domain about an increase in physical or sexual abuse that has been taking place under these lockdown circumstances. Like one of the participants has rightly pointed out, you cannot compare all the states in the same fashion. So I have been given to understand that there are other cases elsewhere. Now, again, over here, I see a major role for the what about the Stree Shakti groups that are working in every place? They know people very intimately, and they know the families very intimately. So can we not include them into the surveillance groups, where surveillance is not just for health indicators, but surveillance is also for well-being? We are looking at children who are getting malnourished because there is not enough access to food materials. We are looking at girls and women who are facing problems due to this lockdown. And who better will they speak to than their own so-called sisters in arms in their own area? So it is high time we looked at building up these kind of the strengths of these kind of women's groups right there at the village level, to look at what are the emerging concerns and to bring it to the notice of the panchayat or the desk, the help desk at the district level, and to see that action takes place. Yeah. So again, I am going back to the very important roles that can be played by the community-based organizations, and how NGOs should look at this new normal and look at how we can strengthen these groups, build up their capacities, so that we look at more sustained interventions rather than just donor agenda-based, funds-based, area-based interventions. I think we are moving into a very meaningful phase if only we are able to build on partnerships, build on transparency, and follow this motto of sustainable, equitable interventions. Over to you, Vikrant.
Thank you so much. I think that's really, you put all the points in the right point. Perspective over there. So it's all about more meaningful interventions. I think I just briefly ask Srirang, as because we're running out of time also now. Srirang, Ani talked about meaningful interventions, and Asi was talking about the technology innovations. How do you think the CSR can partner and support in some of these, achieving some of these? Over to you, Srirang.
Just 1 second, if I can come in. I think I have Professor Santosh online. Professor Santosh, could you say hello?
Hello, can you hear me?
Yes, we can hear you. And I'll come back to you for the final question. But then, Srirang, can I have a brief answer to the question I put to you? Over to you, Srirang.
Well, Vikrant, you asked me about technology and how corporates can support. Is that what you asked me?
Yes, yes. And the meaningful interventions which Annie has been talking about. Yeah.
Okay, so Annie spoke about a lot of things, and lot of things which make sense, and some corporates do understand what she said. Some corporates don't understand, and they are in the process of understanding what actually she said about community coming together and NGOs helping the community to build their own groups and empower themselves. So without using the word empowerment, but coming back to the technology piece, Vikrant, I feel corporates are using a lot of technologies which may be relevant now for the humanitarian space if we are to continue with the social distancing. And I'll just take one example, which is of a low range wide area network. It's called LoRaWAN, a low cost network, and it builds the Internet of Things. Now, in our companies, we typically use this LoRaWAN, what we call it as a Suraksha card for safety purpose. So it's a wearable given to each person, and if there is an alert to be raised, you just trigger it, and you get to know that there are issues, and then someone can go and help the person who is in trouble. Now, For post COVID-19 scenario, when we are restarting our factories, we are using this technology to ensure the social distancing. So two people coming and actually breaching this norm of 6 feet, there will be a trigger, and action can be taken on that. So wearables are available, low cost, LoRaWAN related technologies are available, which may be put to use if we are to continue and actually deploy a humanitarian response, a relief operation while continuing with the social distancing. So there are technologies available which corporates presently use, which can be tweaked and used in humanitarian space. Thanks, Vikrant.
Well, thanks, Srirang. I think I like the other part also when you mentioned about how some corporates understand about this and how we can get more corporates understanding about it. I think that's we can be a discussion for some other time. But it's all about collaboration, and we really good for us to have Professor Santosh back with his voice. And I think, and he's the best man to do the justice with the last question on the collaboration when we're talking about. So, sir, what we saw in this COVID, post-COVID environment is that Ministry of Home Affairs, Niti Aayog, and the government system, from right from the top to bottom, everybody opening up for partnership with the CSOs, and the partnership delivered really a good job. It has not been seen like this for a long, long time. So my question to you would be that how can this kind of a partnership be further enabled and institutionalized through policy and strategize in this new normal, so that we it become an institutionalized, it doesn't remain to a need specific or a case specific like this COVID. Over to you, Professor Santosh.
Thank you, Vikrant. My sincere apology to all the panelists and all the guests who are attending this because of the technical snag, and where the lot of discussion went on the technology itself. So in this, that the entire new normal, you asked this question about that how the cooperation is building up, which was not seen earlier. I would take a clue from what Mr. Major General Manoj Kumar Bindal, Executive Director NIDM, which he has mentioned in his keynote address, that things have changed, and things, how long, we do not know. Number one, we have to recognize these uncertainties which will continue. Second, this COVID-19 is not a local kind of a risk. This is a global risk. So global risk has to be handled globally with a partnership. If we start looking at that India has alone their own strategy and they're not consulting with other, or US has their own this strategy and they're not consulting others, that will not work. So cooperation for all the stakeholders, all the partners, national and international, is the need of the hour. This is one new normal. Second thing which I would suggest in terms of that how this new normal is going to work on when we talk about humanitarian response and taking it further, meaning thereby in terms of like 1 foot distance, everybody is talking about 1 meter distance and how we are going to ensure this. Like today when we are talking about webinar, I'm frankly speaking and candidly accepting this, I was not at all aware about webinar 1 month ago. Webinar, although we have been discussing on technology, but this NIDM's own thing that have changed, the training program and the discussion, all of earlier we used to meet in seminar on Habitat Center and other are in an NIDM campus and all, but now we are preferring technology. This is a new normal where we are adapting it to the change. So how this thing will continue, whether this is going to end tomorrow or this is going to end for, I think we have to live forever. I was just comparing this with what happened with this long back in the Spanish flu. Spanish flu, what are the practices we followed during that time? After 100 years, with the same practice, we are fighting this COVID again. Without vaccine, without equipments, without testing, And again, we are having the social distancing. So social distancing, that time also was the kind of a thing which the community adapted. And this time also we are adapting social. Lockdown was that time also lockdown was adapted. And this time also we have adapted. So we are adopting in this technology, this 100 years old kind of a fighting COVID. Because we have not been able to work and find out, we never knew about this unknown enemy, which is we are fighting for. So this is going to change the whole course, which we are discussing since this discussion started. And you mentioned about, and also Major General Bindal also started, and other partners also said, the panelists, that if there is a cyclone, what is the victim safety and what is the responder safety? This another question would emerge when we are talking about cooperation. And we say that in one funny cyclone, local people, which were been 40,000 local people were actually responding to this disaster. Just a rough calculation which government of Odisha had shared with us. So now 40,000 people from different corners, and that coordination was needed. Now how these 40,000 people are going to coordinate with the social distancing? This is a challenge. So now the time has come to start informing and educating people and the high risk prone area. Like suppose coastal, eastern coast, we can start with this, a cyclone time is coming up. How that community would be educated about social distancing, adhering to at the time of that disaster. The partners like say Sphere India also have the NGO collaborative partners. So how our NGO partners can take this as a kind of social distancing? There are need to educate and inform people keeping that. But then we talk about NDRF and SDR. Say we are saying one example that if your team or NDRF team has to go, they have a say 40 seaters bus, whether they will occupy the whole seats or they will occupy only 20 seats. So social distancing has definitely the kind of infrastructure which we had for disaster management decapacitated us. Now we have to rebuild our capacity as per the new requirement in the new normal. So the point which I'm trying to make is that point you have asked for the cooperation. The cooperation, all partners have to act together, and we need to look at that how we have been doing this earlier. So now the question is this: if we have been doing it earlier, now we need to change that. That will not work now. So here from this moving like early warning system is disseminated, after that we have to act. So how we are going to act? Like relief material will come in millions of tons. How that would be segregated in the course of entire disaster management process of social distancing? Because we are saying disaster response with social distancing. Now this is the new definition. So adapting to everyone, how the victim would be taken care of or victim would be rescued from the debris if person is under the debris. The social distancing process. The new challenges which is emerging, like we have seen in what happened in Vizag. When people were falling on the street, people were not caring about this, what is social distancing. They just the first respond, which is, it is in our habit to respond without thinking anything. So social distancing will automatically at times break, and then you will become conscious of it that we have to be on that line. So this is my first reaction, what you asked for the cooperation. We need to have more and more discussion with
you very briefly, sorry sir,
people who are responding to a disaster or humanitarian agencies. And we need to understand ourselves first that what is and how we are going to maintain the social distancing with each of the partners.
Sure, sir. Sir, can you, may I request maybe if General Bindal is still around, sir, can you also share your perspective how we can institutionalize the kind of a partnership the government and civil society and private sector have already started displaying in the post-COVID reality, how it can be institutionalized? Over to you, sir.
See, this particular issue, when the pandemic was declared, NDMA had called for a conference of all CSOs. You were also there, I was also there for that first conference. That itself shows that there is a paradigm shift where the role of civil society organizations has been felt that it can be used, it can be leveraged to get more benefit to the people. Like Dr. Annie George also said, Finally, what matters is the last mile connectivity. And hence, the connect between the civil society organizations, use of CSR fund, if done judiciously in a coordinated manner. I'll tell you one example. When I was in Mozambique, we started getting relief from so many countries, and finally we realized that we are getting one type of relief in too much of a quantity which was not required, and some things were missing. And then that is the time UNDPKO was approached. They set up a separate department, which was to coordinate that the what each NGO will bring on the table, and thereafter they coordinated how much. They did not dictate them the terms, but they at least limited that you can bring so much. If possible, you bring so much, or bring this item or not that item, because as per the requirement. Today, that mechanism is missing right now. Each CSO is having its own agenda, which it wants to pursue, irrespective of what the others are doing. So somewhere this mismatch needs to be taken out, and in that the government, the Niti Aayog, uh, plays a very important role, wherein there has to be coordination meetings. There has to be all the agendas have to be brought on the same platform, because everyone is working for the same purpose, to bring relief to the people. Uh, Long-term relief, short-term relief, or rehabilitation, whichever way. So that is one major issue which I think the new normal should be, that CSOs has to be taken on board, not only during crisis, but at all times. There should be regular meetings and discussions with all the CSOs, so that the complete effort and funds and resources of the CSOs and the government are utilized in a very, very coordinated manner, and there's no duplication, there is no wastage, and there is no overindulgence of anything. Thank you.
Great, sir. Thank you so much. I think you put it so pertinently at the most challenging aspect of a coordination during a disaster. Sir, I think we will learn from your experience in Mozambique and other places about this coordination. There is already a process is going on the network approach to emergency preparedness and response, where we're trying to see that how the global guidelines on coordination during disasters we can adapt to the Indian context for various sectors. I think we will come to you with more details of it and seek your support to do achieve our aims around that. So I think this has been a very wonderful session. We have run out of time. I would have had some more interesting questions to follow, but it's good if we also hear some questions from our participants. And I see some of the hands up, and Valerie has also summarized the questions from the chat box to me already, but I take up some of the questions from participants first. So my first question is from Mr. Matthew MV. I'm unmuting you, Mr. Matthews. Please ask your question.
Hello.
Yeah, please ask your question very briefly.
Hello. As we know, the people, those who are living in the grassroots level, in the remote areas, how we can educate these people about the hand washing, social distance, and wearing mask? What is the strategy, or how strategy?
Thank you so much, Mr. Matthew. Who would like to address this question? Maybe Annie or Sarabjit?
May I, Mr. Matthew? So communication for development issues is a established sort of knowledge stream, practice stream. And when we look at reaching out to communities, remote communities, where you may have some people who would be illiterate as well, in this situation, how do you communicate with them? And particularly when it comes to cultural shifts, as Major General Bindal mentioned, that we need a culture shift in hand washing practice. Not many people are washing hands with soap. And in such situations, we normally use local influencers. We would normally crystallize the message, discuss it with them, and then use the local influencers, such as might be a faith-based leader. You would use a technology of maybe they would speak from a temple or a mosque. Just use a mic and not, or at times we would involve in the community if it is allowed. Right now in social distancing era, you don't come face-to-face contact with the community to discuss some of these issues, but in normal times we would normally engage with the community to develop their perspective, to develop right attitude, behaviors. So it's a structured process. Over.
Thank you, Sarabjit. The next question is from Mr. Pradeep Kumar. Mr. Pradeep, please be brief and specific. Over to you.
सर आप सुन रहे हैं सर?
हाँ ठीक
हेलो
है।
सर, मेरा भी प्रश्न वही है कि हैंड वॉशिंग से रिलेटेड ही है कि अभी तो हम लोग, मैं 20 साल से हैंड वॉशिंग पे, वाटर एंड सैनिटेशन पे काम कर रहा हूँ, और हैंड वॉशिंग प्रैक्टिस के खाने से पहले शौच के बाद हाथ धोना, लेकिन फिर भी 60% ही अभी हाथ धो रहे हैं। आप देखते होंगे डायस पे भी अगर बिस्किट और चाय आ गया तो बिना हाथ धोए हम लोग खा लेते हैं। तो अभी तो ये ज्यादा डिसास्टर का समय है कोविड-19, कि अगर किसी जगह आप हाथ रख देते हैं तब हमें हाथ धोना पड़ता है, हाथ धोना है। तो कम्युनिटी को जो रूरल एरिया में रहती है उसको कैसे हम सेंसिटाइज करें, और दूसरा स्कूल में जो सर हैंड वॉशिंग का जो है हमारा धोने की व्यवस्था, वहां बच्चे काफी हैं और 2 स्टैंड पोस्ट के बीच में, 2 टैप के बीच में 1 फीट की दूरी है, तो वो उसको कैसे हम लोग दूर कर पाएंगे, ये प्रश्न है मेरा।
अगेन सरबजीत, आप इसका उत्तर देना चाहेंगे?
हाँ, मैं एक अलग तरीके से उत्तर देना चाहूंगा इस बार। मेरी एक पुरानी कलीग थी, कंचन, बहुत लोग जानते होंगे उनको, ऑक्सफैम में हम एक साथ काम किया करते थे। तो एक बार उन्होंने अपनी कहानी सुनाई कि जब वो बहुत यंग थी, और अपने शायद अलीगढ़ की कहानी है कि सोशल वर्क उन्होंने स्टार्ट किया। तो एक मार्जिनलाइज कम्युनिटी थी, मोस्टली माइनॉरिटी ग्रुप्स की, और शहर के स्लम एरियाज में। तो वहाँ उन्होंने, अब उनके पास पैसे नहीं थे, they wanted to work on adolescent health, adolescent education, etc etc। तो उन्होंने कम्युनिटी के साथ बात करी कि भाई देखिए ये तो बहुत इंपॉर्टेंट है कि ये बच्चियों को पढ़ाई होनी चाहिए वगैरह वगैरह, है सारा कुछ समझ लिया सबने। उसके बाद उसमें से 4 बच्चियां एक चद्दर लेके निकली, पूरी कम्युनिटी में घूमे, और उसी कम्युनिटी से 25 पैसे, 10 पैसे, 50 पैसे बहुत लोगों ने डाले उस चद्दर पे, और वहां उस फंड रेजिंग से वो चीज शुरू हुई कम्युनिटी के अपने पैसे से। और मैं याद दिलाना चाहूंगा जो एनी पहले कह रही थी कि कम्युनिटी इज अ लॉन्ग टर्म प्लेयर, और जब कम्युनिटी का अपने रिसोर्सेस पिक्चर में आते हैं, अपने रिसोर्सेस, अपने स्ट्रक्चर्स जब जुड़ते हैं किसी अच्छे काम के साथ और ट्रांसफॉर्मेटिव काम के साथ, जिसको ट्रांसफॉर्मेटिव एक्शन कहते हैं, तो हैंड वॉशिंग भी इसी तरीके से ट्रांसफॉर्मेटिव एक्शन हो सकता है अगर हम कम्युनिटी के अपने रिसोर्सेस को यूटिलाइज करना शुरू करें। अक्सर क्या हो रहा है कि हम बाहर से लेके आते हैं, पोस्टर जिस पे हैंड वॉशिंग के लिए बना है वो भी दिल्ली से प्रिंट होके जाता है, कई बार तो चाइना से भी आता है? सो क्या हमें जरूरत है उस पोस्टर की? क्या वो स्कूल के बच्चे किसी फ्लिप चार्ट पे लाल पीले कलर पेन्स के साथ में खुद नहीं ड्रॉ कर सकते, खुद अपनी लैंग्वेज में नहीं उसको तैयार कर सकते, और फिर अपनी कम्युनिटी में ले जाके अपने पेरेंट्स से डिस्कस करें? तो इस तरह के बड़े ट्रांसफॉर्मेटिव आइडियाज हम यूज कर सकते हैं और बिना ज्यादा खर्चा किए। दीज आर कॉस्ट इफेक्टिव। तो मुझे लग रहा है कि वो जो पुराना समय के जो एनजीओ का जो काम था ना, जो नॉन डोनर ड्रिवन होता था, इट वाज अबाउट सोशल ट्रांसफॉर्मेशन, उस पर उसको न्यू नॉर्मल बनाना अभी बहुत इंपॉर्टेंट है।
Great, Sarabjit. I think I also really learned a lot about this. Next question, Mr. Manoj Kumar. मनोज जी, okay, maybe Ritu Tomar, you can ask your next question. Ritu ji.
Hello. जी सर, मैं सरबजीत सर से पूछना चाहती हूँ कि सर कोविड-19 के टाइम पे सभी लोग हाइजीन और इन सब चीजों का बता रहे हैं, स्ट्रेस के बारे में बता रहे हैं, लेकिन एक चीज इसमें सबसे ज्यादा इम्पोर्टेंस है कि जो गांव में बच्चे हैं इस समय, क्योंकि शहर और गांव के बच्चों की दिनचर्या अलग होती है। अभी कुछ ऐसे लोग हैं जो बाहर से आके गांव में रह रहे हैं और वो बच्चे स्कूल भी नहीं जा पा रहे हैं, बुक्स अवेलेबल भी नहीं है, और अगर है भी तो ऑनलाइन उनका सेशन चल रहा है। बच्चे इस समय ना तो खेल पा रहे हैं, ना पढ़ पा रहे हैं, और जो बड़ों से उनको सुबह शाम आप लोग अंदाजा लगा सकते हैं, जो डांट पड़ती है या कुछ भी कमेंट्स उनको होते हैं, वो स्ट्रेस को बच्चे झेल नहीं पा रहे हैं। मैं अपने आसपास इस चीज को नोटिस कर रही हूँ। तो मैं सरबजीत सर से एक दो इस बारे में सजेशन या कुछ भी इस टाइप का, कि बच्चों को किस तरह से हम लोग मोटिवेट करें, या कि उनका ध्यान इधर उधर चला जाए, कि बाहर जाने के लिए बोल नहीं सकते हैं। तो अगर इस बारे में कुछ बता पाएं सर, थोड़ा सा।
हाँ जरूर ऋतु। एक्चुअली यूनिसेफ यहीं इंडिया में ही नहीं, सारी दुनिया की सरकारों के साथ चर्चा कर रहा है, और इसके लिए सारी यूनाइटेड नेशंस की सारी एजेंसीज भी एक साथ आई हैं कि स्कूल्स का खुलना बहुत जरूरी है। अब ये बच्चों के लिए लाइफलाइन है, बच्चों के लिए प्रोटेक्शन है, और कई बार ये भी होता है कि घर से ज्यादा सेफ स्कूल होता है। और इसकी मैं कोई यूं ही कोई थ्योरी नहीं बता रहा हूँ। 1918 में जब स्पेनिश फ्लू आया था तो न्यूयॉर्क सिटी ने एग्जैक्टली यही किया था कि उन्होंने स्कूल चालू रखे थे, और स्कूल इसलिए चालू रखे थे कि ताकि बच्चों को वो चीजें बताई जा सकें जो जो उनके पेरेंट्स को बतानी चाहिए। तो वो बच्चों को वो बताते थे, और वो टीचर से बेहतर कौन बता सकता है बच्चों को, तो बच्चे अच्छे से समझ जाते थे, और वो फिर अपनी जाके पेरेंट्स और कम्युनिटी में वो बताते थे कि आपको हाइजीन कैसे मेंटेन करनी है वगैरह वगैरह, और सोशल डिस्टेंसिंग होना चाहिए, जो भी जरूरत थी पब्लिक हेल्थ मेजर्स की। तो आई थिंक सरकार के साथ चर्चा चल रही है। अब मैं कोई ऐसा यहाँ से प्रॉमिस तो नहीं कर पाऊंगा, बट ये बहुत ही इम्पोर्टेंट है कि कुछ मैसेजिंग आई थिंक पेरेंट्स पे भी होनी चाहिए, कि पेरेंट्स और कम्युनिटीज में बच्चों के साथ कैसा व्यवहार होना चाहिए। आई थिंक मुझे थैंक्स फॉर दिस इनपुट। मैं जरूर अपने साथियों के साथ ये चर्चा करूंगा, और इसको इस पर कुछ विचार करके इसको
सर सब लोग घर में बंद हो गए ना, तो बड़े लोग अपने
हर कोई स्ट्रेस में है। ठीक है, अभी विक्रांत, वुड यू लाइक टेक इट फॉरवर्ड?
Yeah, maybe one last question, Mr. Srinivas Rao. Srinivas?
Yeah, please. Now I would like to ask Mr. Sarjit and all panelists, can you any possibility to integrate these practices with the local traditional practices regarding our hand wash at a distance, and also mouth coverage as a promotion of the culture? Now over to you, sir.
All questions are to you, Sarabjit.
नहीं, किसी और को चांस दो यार, maybe someone else can speak.
Okay. So maybe some other panelists would like to answer this question. Probably Annie, would you like to answer?
Hello, may I answer that?
Yes, please, Annie.
Vikrant?
Yeah, please.
Yeah, okay. I'm sorry, I'll have to be speaking in English. I don't speak in Hindi, but even in our normal work, we speak about how important indigenous knowledge is, and how indigenous culture, all those should be respected, recognized, respected, and reinforced. And we should build up on that to see that the messages that we have are passed on to the people. So, sir, what you have said is very
Annie, could you be louder?
Sorry?
Because I'm getting chat messages that you're not audible. Could you be a little louder, please?
Okay, okay. Sorry, my bandwidth over here is very low. Probably that's why. The thing is this, that whether we are speaking to the tribal communities or whether speaking to a community which is not the mainstream, an urban community, etc., it is very important that we know what is the local culture, what are the local beliefs, what are the local practices. So what you said about including these things into our own culture and based on that, I think it's a very good way of taking it through. If you remember during our childhood days, the moment come back to a house, there was always a picture of water outside, and we were supposed to wash our feet and hands and face before we got into the house. So things like that, if we can build upon, and that is exactly what is required now. And this concept of a personal space, that we don't jostle people, we respect their spaces, all these were practices that we had followed in our own cultures earlier. I do not really know how and where these got lost, but building on these cultures, promoting these, and also making them aware about how these very same practices can also protect us from such fearsome infections, I think would be a much more sustainable way of doing it than showing pictures of using a tissue, telling them to throw that tissue into a waste paper basket. Our children in the rural areas and really backward areas won't even know what a tissue is. And we don't have enough resources to buy enough tissues to keep throwing it away as and when we utilize it. So you are absolutely right. We have to build up on what our cultures were and promote these messages through those cultures wherever possible. Thank you.
Thank you so much, Annie. While
Grant, over to you.
Yeah. So while there are few more hands and there are a lot of messages, questions and messages also we have picked up, I think we will direct them and reply them offline. Their suggestions also, like, can unrecognized sector be recognized by ILO and state? Certainly, we will take it with the ILO. And there is suggestions like, let's have public-private partnership for this and build more collaborations. Yeah, thanks so all. Thank you everybody for your questions, suggestions. We will work on it. We'll take it forward. And this is also my opportunity to thanks all of you for your patience, for being around, and for all the good work which you are doing on the front lines. Also, my special thanks to all the eminent panelists, Majinal Bindal, Professor Santosh, Mr. Sarabjit Singh, Ms. Annie George, Mr. Mohammad Asif, and dear friend Shriran. Thanks everybody, and we will continue our journey with the next sessions. And I hand it over back to my colleague Valerie for the final closure, as well as any logistics information she has to share. Over to you, Valerie.
Thank you, Vikrant. I hope my screen is visible to everybody. So this is our administrative announcement for today's panel discussion. So to download your certificate of participation for today's panel discussion, please visit the website www.sphereindia19 COVID Academy. Sphereindia COVID-19 Academy.org. Next to the name of the course, please click on the quiz/certificate button. Enter your registered email ID and you will be able to download your certificate of participation. I would also like to take a moment to announce a very relevant session that we are having tomorrow. In fact, it's on impact of COVID-19 on migrant workers in the Indian garment industry specifically. So that will be happening tomorrow. We have quite a representative and versatile panel for it. You will find more details on our website, and we will also be emailing you shortly about this. So the course is tomorrow from 4:30 p.m. to 6 p.m. and I hope to see you there. In case you have any queries or any of your issues have not been resolved, please write to us at covid19academy@sphereindia.org.in, and we will try to get back to you as soon as possible. Once again, I would like to take a moment to thank all of our panelists today, Major General Bindal, Professor Santosh, Sarabjit, Srirang, Asif sir, Annie, and our moderator, Vikrant. I hope I have not missed anybody. All right, so thank you everyone, and I hope to see you tomorrow for another session. Thank you.
Thank you, Valerie, and your team. Thanks all.
Thank you.
Thanks, Valerie, and thanks everybody. Thank you. Thanks.